I'm Dr. Diana Londoño. I'm a board-certified urologist in Los Angeles, and today I want to talk to you about kidney stones. Will they pass, or do I need surgery? So kidney stones are very common. About 10% of all of us will have a kidney stone once in our lifetime. So this is something that applies to a lot of us. So stones can be passed as long as they're in the ureter, but it depends on many things such as the size, the location, symptoms, have you passed them before, what your blood tests show, or any imaging that is done. So this will help us decide if surgery is needed or not. So find out in this video more about this, and don't forget to hit the subscribe button or share with any family. So kidney stones, the most important thing is that if they're sitting in the kidney, they don't cause any pain. It is only when the stone goes down the ureter that pain occurs. And the reason there's pain is because as it goes down the ureter, it starts to block the urine from draining down, and it starts causing a backup or a buildup of urine. And that causes the ureter to stretch, and that causes the pain sensation you may have, and sometimes even nausea and vomiting from the pain. So only when the stone is in the ureter, you will feel pain. Now, one of the most important things to know about the chance of you passing a stone is the size. So we usually measure it in millimeters. And if a stone, for example, is 8 millimeters, it has a 20% chance of passage. If it's 2 millimeters, it has an 80% chance it can pass. So it's inversely related to the size. So usually 5, 6, 7, 8 millimeters or greater have a lower chance of passing. Now, if you've already had stones and you pass them frequently, then for you, the size may or may not be a huge factor if you're able to pass larger stones before. Usually want to give you about 30 days to pass it from the time that it's found. And it does not mean you should be in pain for 30 days, but it just means that you will be checking for 30 days to see if it passes. So what are some things that can help you pass it? Well, again, the size is the most important, where it is located along the ureter, if it's at the top or the middle or the bottom part. Do you have a history of passing them before, or is this your first stone? If it's the first stone, it may be harder to pass a stone. And it's really important to drink lots of water to really help the urine be produced and push it down the ureter so it can come out. It's also important to take some medications if they're not contraindicated to your health or other medical issues that are anti-inflammatory. So these would be things like Motrin or ibuprofen or Toradol. These medications help decrease the inflammation and help the stone pass the ureter. There's other medications that usually give men for prostate issues, but can also help pass the stone. And these are medications like Flomax. So it's important to take these medications, take lots and lots of water, and to strain every time because you want to save the stone to confirm you passed the stone. And you want to save it so it can be analyzed and know what is it made of. This will help later for prevention. It's also really important to remember that even if you don't have any pain, it does not mean the stone passed. So again, it's really important that you strain and you check your urine every time. So there are some times when it's not safe to allow you to try to pass a stone or you failed trying to pass a stone. So these times would be when, again, the stone is too big and you're not going to pass it. We find a 1.2 centimeter stone in your ureter. This is a stone that's not going to pass, and we should do something about it. If you have any signs of infection, this will show up with a fever of 101 or 38 degrees Celsius, or you may have blood work showing that. That's something called your white count. Those are inflammatory cells if they're elevated, or if you have an increase in your kidney function test called creatinine, if that's high and the stone's too big, or even without the size criteria, but if the blood tests are showing abnormalities, this is not a good time to let you pass a stone. Also, if they do any imaging like an ultrasound or a CT scan, and there's swelling or backup of urine, hydronephrosis, and is moderate or severe, this is also not a good idea to let you try to pass it, but surgery may be indicated. Also, if your pain's not well controlled, you keep coming back with the pain not controlled, you have nausea or vomiting, you can't keep food down, or you're diabetic or immunocompromised, or it's been more than 30 days and you haven't passed a stone, then this is definitely a time to proceed with an intervention. And depending on the urgency, you may just need to have something to unblock the ureter. And this can either be done by something called a ureteral stent, which is all inside, or a nephrostomy tube, which is a tube that goes directly through the skin into your kidney, through your back, to drain the urine. Now, stents or nephrostomy tubes do not treat the stone. It does not take it out, and you'll need subsequent surgery to remove it. And again, this is usually done in a setting of an emergency or an infection, and we definitely never want to treat a stone when there's infection because you could get much sicker. There's other videos to talk about stents, uteroscopy, and prevention, and what you can do to further prevent them later on. So don't forget to check those videos out and subscribe or share if this was helpful to you. Thank you so much.